Hey everyone, it's Tammy. So good to be back. Just wanted to apologize. I've been gone for a little while, but that has to do with the fact that I have made a major transition in my life, which was to move from Santa Fe, New Mexico to Newcastle, Delaware. Definitely a big change, but there's really a lot of exciting reasons for this change, and I will continue to share with you what those are as I get these developed and in place. In the meantime, though, I wanted to talk a little bit about bridging the gap. This is something I've been speaking with a number of people, especially in this area, about recently. Delaware, Maryland, Pennsylvania, this is a really big area with regards to, obviously, with medical care, healthcare. I mean, it is all over the place. But coming out of Santa Fe has been, in a way, a culture shock because I was there for almost 30 years. Not that I didn't vacation out of there, it's just that when you're living in the midst of somewhere different, it's just it's very different. And one of the things about Santa Fe is it has a very holistic-minded, alternative foundation on a lot of what people do there. In the East, and I'm sure it is this way in other parts of the country and around the world, it's not as alternative. I mean, they're trying to build this into their lives, and they're trying to understand how to do this, but it's not as holistically minded. And unfortunately, even what I'm finding, regardless of how holistic somebody thinks they are, unless they're working with both worlds, which means, pharmaceuticals and our Western medicine combined with alternative therapies, you're not practicing holistic medicine. And I'm sorry if I've insulted anyone when I say that, but one of the biggest issues that I have is when I listen to a holistic practitioner sit down, and just yesterday I was speaking with the husband of a new client, and he informed me that his wife, who has been diagnosed with some pretty significant medical issues, which one includes diabetes, another one is called RSD, which is a type of neurological dystrophy. It's reflex sympathetic dystrophy is, I believe what RSD stands for. At any rate, she's got some health issues. And she obviously is taking anti-diabetic medication because she is a diabetic. And she went to a holistic practitioner here in the area and was told to come off all of her medications. Well, because she's desperate to get better, she did as she was told, because this is a professional she's paying. And unfortunately, it almost killed her. So this is kind of what prompted me to sit down and just talk with you a little bit about this, because I've gotten into conversations with a couple of other people, several of the merchants in the area, as well as other potential clients, because everybody thinks that when they talk with me, I'm going to ask them to come off their medications. I'm not. First of all, it's not my place to suggest, to tell people to stop, nor is it the place of it's not the place of anyone to tell people to stop their medications. Those medications have a very particular benefit to the body. There is a mechanism, a way that they operate within the system, and to just stop those cold turkey is very harmful. And so one of our philosophies in healthcare, whether you're practicing Western medicine or holistic medicine, is to do no harm. So to tell somebody not to take their medication is actually harmful. With that said, as the other side of the boat, I know there's a lot of Western medicine doctors that don't have any time or place or desire to work alongside holistic practitioners. They think that it's quackery, and I don't really want to actually put any words into that as far as their beliefs. I do understand their concerns. At the same time, I don't believe that they should be telling their patients not to use natural choices. Now, I say that because I think sometimes as a patient, we misunderstand when a doctor says don't use this herb or don't use natural supplements, that we may be misinterpreting what they say as far as don't use anything versus don't use these particular kinds, because there are some, well, everything can be contradictory and create, well, it would be, yeah, contraindicated. I'm going to say that. They could cause adverse reactions depending on how they work within the body and what mechanisms they're triggering within the body. So let me say a little bit about that. Every chemical that we are exposed to, whether it be something that we generate internally or something that we're exposed to externally. So obviously we know there's external toxins. There's air pollution, there's water pollution, we have these e-cigarettes now that are toxins and chemicals are being exhaled into the air. Yes, you may not be able to smell it, but they are being released into the air. And if you're standing anywhere near, you are getting chemicals into your system. Same thing with secondhand smoke. So we know what our external toxins are, or chemicals. Of course, that also includes your foods and your drinks and anything that you apply to your skin is being consumed by the body. Everything that we take in, whether you can smell it or not, is affecting the system. And I will get into that a little bit more. That includes medications and supplements as well. With that said, we also produce our own hormones with genetic adaptations, otherwise known as polymorphisms, or SNPs, is for those people who are involved with methylation, MTHFR. These are different ways of calling them genetic adaptations. These are variations, defects, polymorphisms, however you want to call it. All it means is that the genes have been switched off and on, off and or on. Some of our genes actually do that. They will actually turn themselves off as needed, as well as turn themselves back on. This is the epigenome. It's known for being able to modify itself. It can modify itself depending on thoughts and, again, external stimuli as well as internal stimuli. However, there are those that don't necessarily always become modified for a various number of reasons, and in that case, the wrong nutrients are being used or not being used at all, and so the body in turn begins to produce toxins of its own, whereas it might produce antioxidants and its own anti-inflammatories. It will actually produce something the exact opposite that causes inflammation, that causes and stimulates, allows free radicals to come into the body. So these are issues that we have with the genetics that are not being modified. There again, some things that are very important to remember is that our own hormones will actually inactivate and activate various enzymatic processes in the body. So what that means is, depending on what the body is needing, it will actually, it'll stimulate the production of more chemicals of its own and begin to trigger alterations in our own genome. So this is occurring at all times, and this is the reason why I am a firm believer, and that we really need to begin paying attention to the things that we're consuming. Now, yes, there are things that we have no control over. We have no control over what's in the air. We have no control over additives in our food. There's just certain things that are there. But yes, we can actually choose our foods more wisely. We can begin to select our herbs and our oils more wisely, beginning to choose supplements that don't necessarily have a lot of fillers and additives to it. So there are things that we do have control over, and beginning to work with the body, paying attention to what the body is actually going through. On that note, though, there are some medications that are contraindicated and can create adverse reactions with certain herbs and as well as oils. St. John's wort is a perfect example of that, because we know that it's contraindicated with antidepressants. And so anybody who's been taking antidepressants or going on to an antidepressant really wants to avoid St. John's wort. That said, there are ways to support the body through intentional nutrition, and that is actually selecting foods that contain the nutrients that are depleted by these medications, and using oils also to support the neuroendocrine system. Again, it depends on the individual. I get asked all the time, well, what would I recommend for this condition? And I can honestly tell you that I cannot give you a flat, firm answer on any one health condition until I gather all the information about that particular individual, sit down and assess it, and then provide feedback as far as what's recommended for nutrients and what's recommended for oils, what herbs would work with medications, what potential supplements would be beneficial. All of this works together, and this is where I come back to saying bridging the gap. I believe it's time for Western medicine to accept the fact that if they really want to help their patients, which I believe they do, then it's time to allow their patients to embrace the fact that holistic medicine, or alternative, or natural is a better way to say it, natural solutions actually do benefit. There's plenty of German research out there that has indicated that medications fare better when supported with essential oils. So, this goes for the case of cancer. I mean, any autoimmune disorder. These are health conditions that absolutely require medications for a number of reasons, as does diabetes. These health conditions are much better off being supported by an actual holistic. That's what holistic means. It's accepting the whole thing, accepting the entire system. And Western medicine is not holistic. And if we're practicing natural medicine and we're only treating the symptoms, we're not being holistic. This is according to the way I understand it and the way I like to practice. If we're talking about holistic medicine or holistic treatments, we need to be considering everything that we have available to us and working with the entire system, allowing the cells to get the right nutrients, encouraging the body to work with the medication. And because what happens when we use medications is these medications are targeted for very specific receptors and activities within the body. What happens in that case, like I said earlier, with, when I was talking about hormones and any chemicals, the body switches things off and on as necessary in order to protect itself and produce chemistry that is going to support the body. Now, I know many of you would say that, bad health or ill health is bad health, right? But the funny thing is that's because it's gone on for a long time. It's because the person or the people aren't paying attention to the initial symptoms of the, of the potential, pain in the stomach. Possible, obviously it's going to be bowel issues a lot of the times. It could be diarrhea, it could be constipation, it could be a little bit of both. It could be acid reflux. It could be just indigestion, insomnia. Any of these things are indicative that something is going on in the body that's asking you to please pay attention now. But the longer we don't pay attention to that, the further the body begins to decline. And the more the body begins to decline, then we need to begin doing other things. But in my world, it's not just symptom relief. Symptom relief is important because we want to feel we don't want to be just uncomfortable. So we want to minimize the discomfort and at the same time help the body get to where it's going. I was visiting with a man earlier this morning. He wants to work with me. He is, in his mid to late 50s. He's got COPD, he's got high blood pressure, and he's been suffering with seizures. All of this set in his 20s. The very first thing that they did was they put him on anti-seizure medication. Well, that makes a lot of sense in the way we typically think. But if we don't look at the root problem and we don't look at, what could be potentially causing this, which, by the way, biotin, which is a vitamin B, helps with preventing and curtailing, more importantly, seizures. It could also have been, so we don't really know what the trigger was, but helping him then would have possibly offset the fact that he now has COPD and high blood pressure, because the COPD doesn't run in his family. This is something he's developed over time, and no, he's not a smoker. So it's things that he was exposed to as a young child that created these symptoms from the very get-go, and it just has progressed to this point. So now we're going to back it up a bit and actually help him find a way to actually restore wellness. So that's kind of the what this is about. Am I going to take him off his medications? No. High blood pressure medication is something that, as patients, we actually all have the right to take ourselves off of medication, but never cold turkey. It's best to always speak to your health practitioner, your health professional, and meaning your doctor, and have them actually guide you down. You can say, I'm wanting to do this, and I'm wanting to come off of these. I'm done taking these, and I would like assistance, please. If they don't want to help you come off of them and find an alternative way, then my encouragement is to find somebody else who will, because you have the right as a patient to do or not do something. It gets a little bit trickier. Well, actually, with anything, I just wouldn't come off of anything cold turkey, unless you're just having some really bad adverse reactions. But just so you know, that there's a lot of medications that I've seen that are contraindicated with other vitamins as well. And so it really depends. I mean, I've seen it with minerals, calcium, magnesium, potassium. So these are very, very important things to know and to remember, so that because you could actually be causing more problems, more harm than good. I had a patient come to me, a client I've been working with now for a while, and we had to work closely with her physician to get her to change out her high blood pressure med. She's been taking it for almost 25 years, and it's actually triggering psoriasis flares. She's had the psoriasis prior to taking the high blood pressure meds, and then she had to go on the BP meds. The problem is that this particular medication is actually linked directly with psoriasis flares. Not in everybody, because medicine, keep in mind, is not one size fits all. It varies from person to person to person. But there are many reports around the world that this medication is linked to psoriasis flares. We tried to treat her with the oils. The oils would clear it up, but then she would come back with an issue. And the doctor told her she was allergic to what I was providing her, and which of course alarmed her. So I supported her, explained to her, provided her with the information that she needed to be able to take herself back to the doctor and demonstrate that this was actually a healing crisis, that the body was trying to work itself through the psoriasis and was unable to, so it was exacerbating the psoriasis, and that in fact the medication was what was triggering this. She went back to him. It was an intriguing experience to see, because at this point she hadn't been using the salves that I provided her for close to about a month, and finally got in to see the doctor. The doctor, of course, didn't want to take her off the medication that I said was actually linked to this. She was on 2. Took her off the other one, and so then she was confused. She contacted me, and I said, well, let's look at it this way. He's at least working with you. He's listening to you. He's working with you. Let's just go with what he's doing. So I've been continuing supporting her, with nutritional recommendations, as well as just kind of explaining things to her as she's left the doctor's office. And he had explained to her that he was going to give her a few weeks just on the one med, and weaning her down off the other one. And And if she didn't clear up, because at this point she has now gone into a full flare, her legs, her arms, everything has been just swollen up. And she was very alarmed, and I told her, I said, I don't want you to be alarmed. I want you to understand that this is unfortunately perfect, because now he's going to see that you haven't been using these salves for almost 5 weeks, and you've gone from bad to worse. So at any rate, when she went in, it was 1 week later, only 1 week after that first visit, they took her off of everything and replaced it with a different medication altogether. So he finally heard us, and that's really what's important. So now she's taking another blood pressure medication. She's protected, and we can now work to get the psoriasis out of her body. So and actually help her heal. So these are the kinds of things that we need to be privy to, and the opportunity to be able to work with both. We can see clearly that there was a contraindication between the way the body was using the oils, as well as the way the body is using the medication, combined with other things that she was doing. I posted on Instagram the other day, which happens to be at Tammy Davis 8, that our liver is not a sieve. And, we have a sieve and it just lets everything run through. The liver doesn't act like that. The liver actually filters everything and it breaks it down. So one chemical can be broken down into many components. I mean, a good example is caffeine is broken down into xanthine, theobromine, and oh my goodness, I just had a blonde moment. Anyway, I'll remember it and I'll add it to the video here shortly. But anyway, it breaks it down into these chemicals and then it continues to break it down. This goes for alcohol, this goes for cigarettes, this happens this happens between estrogen and testosterone, serotonin and melatonin. I mean, we're converting chemicals all the time. So the liver is not a sieve. It is something that actually works directly with every chemical, filters it and breaks it down for either use or elimination. And therefore, so what that means is sometimes, and this is what scientists know, is that different chemicals will turn off certain enzymes. And if there's a genetic adaptation on that gene complex in the liver, now you've just got a double whammy. So if it's going to turn something off in order to produce a different chemical, this is going on all the time, which means essential oils, herbs, foods, they are all acting like this at some level in the body, and we have to be aware of this. So in this particular client's case, we saw the interactions, took her off of the one until we could get support with the medications, and now, these salves that she's got will actually work hand in hand with the type of medication that she's currently going to be taking. So this is what's exciting, and this is what's possible when we actually bridge the gap. Same thing holds true for histamine. That's, I know, a very big concern for many people, many of us. As I mentioned, estrogen also. Histamine is part of the immune system, and it is also activated between the liver and pancreas. It's utilized in that function as well, that relationship. And there are receptors in a lot of the tissues in the body, which includes the gut and the heart. And there are many medications that, especially in the arena of, obviously we have antihistamines. Those are the ones we use. That will deactivate the histamine in the body. Sounds good because it deliberately forces those symptoms to stop. But if you're actually deactivating histamine, you're not protecting your body otherwise. And there's, like I said, there's antidepressants that actually work against the histamine. There's anxiolytics that work that affect those histamine receptors. And the sad part about that is, or the troubling part, more importantly, is the fact that those histamine receptors, like I said, are involved with the heart. And so it's very important, as far as I'm concerned, to be able to support these functions and recognize that sometimes when you take these medications and you believe you have a histamine problem, it may be that you didn't have one until you started taking the medications. The histamine is broken down in a number of ways. It's metabolized by the body. It's utilized by receptors, and it has to be deactivated also. And if any one of those genes is affected, or you're not producing enough SAMe, say, you're going to struggle to break it down and deactivate the histamine, and so now you're going to have compounded problems. So, and again, the neurochemistry is really what's affecting the entire physical body, not just the brain. Even though we think about neuro as brain and nerves, it's the entire system. And these systems are really necessary, obviously, for us to live, and to keep, offsetting these different receptors in order to produce an effect over here. You're stopping an effect over here. And so it's really very important that we, again, work with the whole body and beginning to support the full function, not just portions of the function, because the longer you're on a medication, the longer something else isn't going to be functioning properly. And if you're on medication that is, necessary, and I say necessary, and like I said, in some of these more chronic health conditions, then you want to support it intentionally. You really want to get in there and know what foods are beneficial. And if you have a particular concern about certain foods, there are other ways to work with that. I had someone the other day contact me. She has a history of eating disorders, a long time actually. Her family history is addiction and depression. And her main issue for contacting me was severe impaction. I mean, what I mean by that is constipation, to where she doesn't go for days on end and can only go through the use of an enema because she used laxatives for so long. This is something that can be healed and reversed with time. It is incredibly problematic, extraordinarily uncomfortable to have to live this way, but it's not something that she has to live with forever. The challenge with it is that we have to understand eating disorders are just as much of an addiction as, smoking meth, snorting coke, smoking crack, drinking alcohol, smoking cigarettes. An addiction is an addiction, and it doesn't necessarily mean that you have to be using an illicit drug or have severe, basically using substances. There are behaviors, and if she already had issues neurochemically with depression, which more than likely she did, it would potentially the eating disorder. Well, it's involved. Because we're talking about perfection, we're talking about control. I don't know her family history as far as her relationship and the dynamics are concerned. But what I do know is that the neurochemistry is involved with bowel movement. And if she's not producing it in a balanced way, it's going to seize up. And it is possible to actually restore the digestive system and help restore a healthy bowel movement. She was a little bit concerned about some of the foods that I had suggested that would actually benefit her, and understandably so. She's coming from an eating disorder, and at that point we need to work hand in hand with psychologists, because there's some healing psychologically that needs to occur around those, around that realm of restoring wellness. But in the meantime, we can certainly restore the system so that she's no longer suffering and struggling. And combined, it works very, very well. So these are some ideas about why bridging the gap is so important and why it's beneficial. And for those who aren't working with Western medicine and who are in on the early stages of seeing symptoms, it's always wise to get a consult to find out if, to see what you might be able to do to offset any future problems, as well as what might actually be beneficial and what might not be beneficial. Because like I said, not everybody is built the same way. We all don't require the same thing. The one thing that disturbs me more than anything is you open a book up and it suggests that we use this for this reason. But my body is as different from my son's to my neighbors. We're all different, and we have to work within those differences. and recognize it. And there's also things that we can't do for very long. I mean, there's certain oils you can't use for very long. It's necessary to change them up. There's certain herbs that can't be used for very long because they do affect the entire system. Remember, every chemical that we consume is affecting our genetics. And so when they say, whoever they are, that our genes cannot be modified, the genetic expression cannot be modified, they're not being accurate. Science knows that these some of our genes can be activated and inactivated very readily through the introduction of various chemicals and even our thoughts, our stress levels. So these are all very important things to remember. And if you'd like to talk with me further, you're always welcome to contact me. I look forward to hearing from you. And until then, have an absolutely beautiful evening. Take care. Bye now.